know what healthy living is all about? Do you want to know how can you live happier and longer? How about learning about balance, spirituality, and prevention? To know how you can live in harmony with others and how to add balance to your life? Know more about prevention and many, many more of the health topics?
Make sure to listen to Healthy Living. Healthy Living, prepared and presented by Fida Amin.
Good afternoon, everybody, and welcome to Healthy Living. Healthy living, my dear listeners, is a new way of thinking and a new way of living. And what I mean by a new way of thinking is the fact that we need to reevaluate our priorities, how we make decisions, and also try to make our health and our kids' health, our friends' health, a priority as well. Once we set health as a priority, and it's the most important thing that we need to accomplish, then I guess all our decisions and activities will be normally directed that way. But at the same time, we also need to be committed and determined to this new way of thinking. But we need encouragement. The people around us need to give us support and encouragement as well. We need our families to help us lead such a lifestyle. We can't do it alone because we're sociable. We don't live alone, and we need support from everybody's involved. I know it sounds difficult, but it's really easier than what we think. Try to have more people involved in your new lifestyle, and then you will see how everyone will follow. Because after all, what you are starting is not bad at all. It's actually very beneficial and useful. They will see the positive effect on your health and your life. And then they will be more encouraged to join you and maybe learn more about how to be part of it as well. So for today, our topic will be discussing smoking. Why smoking? Because it's very popular here in Jordan. Unfortunately, popular among men, women, adults, and teenagers as well. Smoking contains tobacco, and everybody knows that tobacco is a killer. And because of its popularity here in Jordan, I thought I should discuss this topic with you today. So before we proceed talking about tobacco and its harm, or smoking in general, let's hear first what our students here in the JU campus would have to say about smoking with this recorded report prepared by Noor Al-Aqad.
My name is Jawdat.
Jawdat, do you think smoking is a bad habit?
Yeah, I think it's a very bad habit.
And are you aware of its dangerous impacts on health?
I'm sure we all are.
And do you think it's addictive in any way?
Yes, I think it's one of the most addictive things.
And can any smoker quit by him or herself, in your opinion?
Yes, I think any smoker can quit, giving they have the will to do it.
Thank you.
Yusuf, architecture.
Yusuf, do you smoke?
Yeah,
And when did you start smoking?
5 years ago.
Why do you smoke?
I feel like it's a relief or something. I enjoy it. That's all.
Hello,
Hi,
how are you?
I'm good.
And what's your name?
Janine,
And what's your major?
English literature.
Janine, do you think smoking is a bad habit?
Yes, definitely.
And are you aware of its dangerous impact on your health?
Absolutely. I think most people are aware of that.
And do you think it's addictive?
Absolutely. It's addictive because it's scientifically proven that it's addictive.
And can any smoker quit by him or herself, given that it's addictive?
It's possible that they could if they have strong willingness to quit.
Do you think that any family support would be a good thing to have for anybody to quit smoking, or is it just personal?
No, it should. The family definitely helps because if you're having people smoking around you, it doesn't encourage you. It more discourages you.
Thank you so much.
Thank you. Bye.
What's your name?
My name is Shuruk,
And what are you studying?
German English.
Shuru, do you think smoking is a bad habit?
I think it's a very, very bad habit because it affects the body in a very negative way.
So it has a lot of dangerous impact on your health.
Yeah, of course it does.
And do you think it's addictive?
I think it might be addictive, but it's definitely controllable. You can get over it.
Do you think any smoker can quit by him or herself?
Yeah, definitely, because it starts within themselves. The environment has a very big impact, but you can definitely control yourself.
Okay, thank you.
You're welcome.
What's your name?
Mustafa.
And what are you studying?
Mechatronics.
Mustafa, do you smoke?
Yes, I do.
And when did you start smoking?
2 years ago.
And why do you smoke?
Because it feels good.
Well, since you are a smoker, do you think smoking is a bad habit?
Yes, I do.
And are you aware of its dangerous impacts on your health?
Yes, I am. Well, I don't know, actually. I can't quit right now.
So you think it's addictive?
Yep.
And can any smoker, including yourself, quit by yourself, or do you need a push?
Well, I think I need a push, but I think other people can quit by themselves.
Okay, thank you so much. What's your name?
My name is Laith.
Laith, do you smoke?
Yeah.
And when did you start smoking?
7 months ago.
And why did you start smoking?
I was pissed off from my exam, and that's the first thing that comes on my mind.
Okay, thank you. What's your name?
Riham.
And what are you studying?
Nursing.
Riham, do you think smoking is a bad habit?
Yes.
And why do you think that?
It's effect in our environment, not in just person, and it's very effective in community and not ethical.
And do you think it's addictive?
Yes, because it contains many substances causes this addictive.
And do you think a smoker can quit smoking by him or herself?
Yes, sure.
Okay, thank you.
All right, back to you, everybody. And that was a great report from the JU campus. As we all heard, smoking, unfortunately, is popular among youth. I really had so much questions in mind about smoking and how and why people get involved so easily in smoking. We're actually accepting smoking as a habit. And we most of the time accommodate that habit. So, for example, if you have a guest coming to visit and ask for an ashtray, you would offer the ashtray and allow them to smoke in the house, even if there were kids around. We consider asking a guest to smoke outside inappropriate, for an example. So ignoring the fact that secondhand smoking is very harmful for you and for your kids and everybody's around that smoker. Let's hear more about smoking with Dr. Nadir Abedat, the Department Head of Internal Medicine at the Jordan University Hospital. Let's listen together for what he's going to say about that. Good afternoon, Dr. Nadir Abedat. We are very thankful for your time and happy to have you with us today. Please let us know more about you and your job here at the JU Hospital.
I am Associate Professor at the Faculty of Medicine, University of Jordan, and also I am chest physician, intensive care physician, and sleep medicine physician at Jordan University Hospital.
Doctor, this episode is all about smoking. We would like to know more about smoking and how it can impact our health. So let me start by asking you, why do people begin to smoke?
Thank you for discussing such very important subject, which is smoking, because smoking is a social problem that affect large percentage of population, affect their health and their economical status as well. So why people they start smoking? As you know, most of people they start smoking at young age, and especially when they have their age between 15 and 20, and people they start smoke probably because of some stressful condition, other reason that people they want to do something which the other people they do it. So when we talking about student in the school, if one student see his colleague smoking, probably he wants to do the same thing. So most of the time there is no obvious reason why people they smoke, but these things most likely are the causes for people why do start smoking.
Do you think that the environment would encourage, like if you're living where so much people smoke around you, and the culture itself, like, you know, everybody smokes and it's okay to smoke in our culture, do you think that's another factor that can encourage people to start smoking?
Unfortunately, smoking is acceptable social activity. In most of the countries, it's socially accepted behavior and attitude, and this is an important issue because when you see a lot of people around you they smoke, probably this encourage you to smoke as well. So I agree that the environment, the social environment is important for people to start smoke.
So it's very encouraging. Now another question is cigarette smoking is really addictive?
Yes, it's addictive. It's well known that smoking is causing addiction. So it's not it's not weak addictive material. It's considered one of these substances that cause addiction. Even more than many other things like alcohol, for example.
So since it's addictive, what are some of the short and long-term effects of smoking cigarettes?
I think this is a very good question. As you know, for the short-term effect on smoking on the health, if you mean, this is important because me as a chest physician dealing with patients who suffering from asthma, for example, once you smoke, or even if you smoke from the environment around you, this smoking aerosol which you inhale it as patient who suffering from asthma, this will affect these patients directly and causing acute this will cause problem. It may trigger acute attack of asthma and causing symptoms like cough, short breath and wheezing. So about long-term effect of smoking, it's well known that smoking causes many chronic diseases, and the diseases started from it increased the risk of strokes, it increased the risk of even blindness, it affects the mouth, the teeth, and can cause teeth problems. It affects the heart. As you know, the smoking is very well known risk factor for heart attacks, and also it affects the lungs. It is well known that many lung diseases, especially what they call COPD, chronic obstructive pulmonary disease, the cause of this chronic lung disease is smoking in more than 90% of cases. So 90% of patients who have COPD, they are smoker, and especially cigarette smoking. And also it's well known cause for lung cancer. Again, it's known that people who smoke, they are at high risk to have bladder problem, bladder cancer, and also many other cancers, even leukemias. There is evidence that smoking increases the risk of these leukemias and other types of cancer also. It's well known the link between smoking and the prevalence of this type of tumors in many organs, actually.
So, Doctor, we could be spending hours and hours talking about the bad effects of smoking. Now, Dr. Nadir, I want to also ask you about environment. Do you think that smoke or smoking tobacco can also have danger? What are the danger of environmental tobacco smoke, or what do we call it, the passive smoking or secondhand smoking, the EETS?
Yeah, this is an important thing, and always it's important to talk about passive smoking. Passive smoking, it can affect people who who they are not direct smoker, and it can causes it can cause problems in patients, for example, with bronchial asthma. As I said before, if these patients inhales smoking from other people, this can affect their health and causing acute attacks and bronchospasm and causing symptoms like cough, wheezes, and short breath.
What do you say for people who's really spent so many years smoking? Can you say today that quitting will still help them and benefit their bodies?
Always it's important we as physicians to encourage our patients to stop smoking. And even if they smoke for a long time, again, it's important to encourage them to do so, because many diseases will affect in positive way if they quit smoking. For example, in my specialty patients with COPD, which is the most important and most common disease affected by smoking, if they stop smoking, of course this will stop the decline in their lung function, and probably also it's well known that it will affect their life, so it improve their survival and improve the decline in their lung function and the quality of life. Patients who have problem with their vessels, coronary artery disease, quitting smoking will decrease their risk to having more heart attacks and problems in the heart.
Well, that's very interesting to know that you will maintain the health that you have. Things are not going to get worse, at least. The least that you can achieve. Now, can smoking lead to other addictions such as drugs or weed?
It's well known that if you are a smoker, you are at high risk to have more other habits and to make you more addicts with other substances like alcohol. It's difficult to have one who drink alcohol, for example. He's not a smoker, and also for other things like hashish and other drugs.
So you agree that it could be the first step into the world of addiction?
It's one step before having more addiction, unfortunately. But it doesn't mean, of course, that everyone who smokes he has to be addict for other. But it helps. It helps if the other factors again are available for having more addiction.
Now, Doctor, I want to also point out something that the University of Jordan carried out awareness campaigns like against smoking. Do you think that increasing the awareness will contribute to the anti-smoking among young people and youth? Do you think that's can help with the awareness?
Yes, it's very important always to have regulations and to organize programs for to prevent spreading of smoking in general, and also on the other hand it's important to have programs for smoking cessation or for quitting smoking. People who are already they smoke, to help them quitting smoking, and also, as I said before, to prevent people to start smoking as well. So people who doesn't smoke, to be aware that about the negative effects of this habit on the health, their health and the health of other people.
Doctor, as a head of Department of the Internal Medicine at the JU Hospital and in your location here, do you think that we have enough of those campaigns and programs? Do you think that we need to work harder on increasing the awareness and the dangers of smoking?
Again, education and awareness is very important to prevent spreading of smoking.
But do we have enough?
Always we need more education, more awareness, and not only from the University of Jordan, and probably we need to have more campaign on the level of the country as well, and between and the other institution to take hand for this as well.
As a specialist, as an expert here at the hospital, what do you give? What advice you can give for youth out there to about the cigarette and how to maybe quit cigarette?
We are sure 100% that smoking has very negative effect on health. It causes serious diseases. it causes a lot of even socio-economic problems for people. So please, I have to say, please, for our young population, please think about these side effects, these negative effects on smoking, and try to avoid this bad habit, because if you avoid this, probably you keep your health in better condition.
Thank you, Doctor, for being with us. Thank you for your time, and hopefully we'll have you for more episodes where we can give us more information about healthy living in general. Thank you, Doctor.
Thank you, Fida. I wish you more success.
Thank you so much. Bye-bye. Back to you again, my listeners, and more about smoking. Listening to Dr. Nadir about quitting, what really concerned me of what he said, that I've always thought that quitting smoking is something we can all do on our own. Like smokers can just decide that they can quit and they will quit. Well, it's not actually impossible, but we can't quit on our own. That's what really concerned me of what I heard from Dr. Nadir. Asking for help is an option. And the good news is that there are many ways that can help us quit. If we have, of course, the desire to quit, which I think is the first step to quitting, is to decide to quit, to have that awareness or have that determination and to insist on quitting. And with all that inside our heads, the smoking bad effects, we know about the bad effects of the health on our families and our communities, but unfortunately we are still into smoking, and there are an increasing number of smokers. So what I wanted to say, that you don't have to wait till your son or daughter starts smoking. We should act faster and think of ways that can help make the decision to choose not to smoke. That's what I think, where we should start fighting smoking. We should start talking to our kids, spend more time with them, and have an open conversation about the issues and the challenges they face. Like, try to build up a stronger relationships, be open about talking about the topics that they enjoy, and try to give them a space when they talk about their issues, not give them a feeling that you're the parent and they should be scared of you. So trust them, trust your kids, and listen to them. And how explain to them about how we can help addressing their problems and their issues. So for an example, you can ask your kids about smoking openly and how they feel about smoking. Ask them about what they are attracted, what attracts them in smoking, and try to be more involved in their lives and be an active part of it. I believe at this point your kids will be interested in the conversation, because I bet you they may be afraid of speaking openly about it. Acting as an understanding parent would build a stronger relationship with your kids and would lead to a great result. So the focus here is prevention. Before we even get into treatment, that's what we try to build with our kids before it's too late. Now, for people who are already smoking or have loved ones that is smoking, let's talk about an action plan. As usual, I always give you action steps to perform toward the issue or the health problem that you're facing. So how to quit smoking effectively and permanently? Let's start with the step 1. Step 1, my dear listeners, is to decide to quit, which can be, I know, very challenging. Yet it sounds easy, but you have to have the courage to make the decision and the desire as well. And most importantly, to be committed to that decision. Now, step 2 is all about support. And when I say support, remember, you can't do it alone. And we don't live alone in this world. So accept the help and get the needed support from your family, friends, and doctors as well. Don't hide the information and believe that you can do it on your own. Don't be afraid of getting help from others. Also, doctors have many ways and products and medications that can help you quit. If you can't do it alone, and if you're not getting enough support and help from family or friends, or you're not living close to your family, you can always visit a doctor, because doctors nowadays have many products and advices that they can provide you with and help you with this step. Step 3 can be planning for challenges. As someone who's trying to quit smoking, most probably you will have so many challenges. The challenges I've talked about is like the challenges that make it harder for you to quit. So for an example, avoid the high-risk places where smoking is so tempting and allowed. For an example, try to go where smoking is not allowed, such as malls or movie theaters. You can't smoke there and it's really not so tempting. So plan for challenges so you don't have to deal with it, and that'll ease the craving for smoking. Another very beneficial step is to get physical. You know what physical activities do? It can actually help distract you from tobacco cravings and reduce the intensity of cravings. So get yourself busy, get yourself going, practice some activities that you enjoy, and believe me, 30 minutes of moderate physical activity can make a tobacco craving go away. So get going. A very useful step as well is practice relaxation techniques, because quitting can be very stressful. So take the edge of stress by practicing relaxation techniques such as deep breath exercises, muscle relaxation, yoga, and if you can afford massage or someone at home can help you with that, that'll be super way to for stress release as well. Finally, you can remind yourself of the benefits of quitting, of course. Write down or say out loud the reasons you want to stop smoking for and resist tobacco cravings. These might include feeling better, getting healthier, sparing your loved ones from secondhand smoke, or saving money. Those are the things that you can keep reminding yourself of. Now remember, trying something to beat the urge is always better than doing nothing, right? And each time you resist a tobacco craving, you are one step closer to being totally tobacco-free. All right, everybody, our time is up. Stay tuned for more episodes and more health topics that can change the way you live. And remember, don't smoke. There are cooler ways to die. And always say, I quit because my kids love me. Goodbye and have a wonderful day. Do you know what healthy living is all about? Do you want to know how can you live happier and longer? How about learning about balance, spirituality, and prevention? To know how you can live in harmony with others and how to add balance to your life? Know more about prevention and many, many more of the health topics?
Make sure to listen to Healthy Living. Healthy Living, prepared and presented by Fida Amin.